At the White House Coronavirus Task Force briefing today, CDC Director Rochelle Walensky says that while we have seen a decline in cases recently, we are not in the clear yet.
Cases remain extraordinarily high, still twice as high as the peak number of cases over the summer. And the continued proliferation of variants that likely have increased transmissibility, that spread more easily, threatens to reverse these recent trends. Based on contact tracing and recent variant cases, not wearing masks and participating in in-person social gatherings have contributed to the variant spread. We must take prevention intervention seriously.
For more on this, I want to bring in Dr. Rashmi Jain. She's a pediatrician and the founder of babiesmd.com. Dr. Jain, welcome. Great to see you. What do you make of this new data about the Oxford-AstraZeneca vaccine, that it not only helps prevent the illness, but stops the spread as well?
Good afternoon. It's good to be with you again, Tanya. I think this is great news. To be honest, we are so scared about the severity of disease. We're scared about hospitalization. We're scared about death. And the vaccines out there have shown us they can prevent severe disease. Now, what Oxford-AstraZeneca is telling us is that they've been doing weekly swabs to see if the people who have gotten vaccines in their trials are actually able to transmit disease. And that has dropped by 67%. That is amazing. That is after one dose of the vaccine. They're also thinking, and this of course remains to be peer reviewed, so we're still looking for the formal reports to come out, but this information is very, very reassuring. I think many of us walk around, we're not sure if somebody who's walking by us might have the disease. We see somebody who doesn't wear a mask and we're worried, could they possibly be coughing it into the air around me? We hear stories about hang time, super spreader events, and it's very frightening. So this information about reduction of 50 to 67% transmissibility with this vaccine is very reassuring and exciting. Now, the other thing is we don't have this data from other vaccine makers like Pfizer and Moderna, and hopefully they'll be able to start giving us this information as time goes on as well.
So, Doctor, the Biden administration says it will deliver vaccine doses directly to thousands of pharmacies across the country. How much do you believe that this will help speed up the vaccine rollout?
I'm very hopeful. I think anytime you start a new game, and this is truly a new game, it's a new ball game, it's vaccine, it's an effort to get as many people vaccinated as soon as possible. Anytime you start a new game, there's going to be a little glitch in the beginning. There's going to be glitches. There's going to be learning curve, experiences. But the fact that President Biden's team is saying they're going to be starting up vaccination through retail pharmacies is awesome. So CVS and Walgreens are getting ready to be live in 11 and 15 states next week. They're sending out special doses just to these pharmacies. So what had been happening till now is the state's allotments were going to CVS and Walgreens to be distributed to nursing facilities and long-term care facilities. But now what the administration says is there's going to be doses that go directly to retail pharmacies. Though they're only starting with 6,500 pharmacies next week, the goal is to get up to 40,000 retail pharmacies nationwide. How many of us depend on our pharmacy for those medications, for those flu shots, for those sometimes in the summer sports vaccines that children need before they can go to school in 7th grade and play sports? So the reality is these are known people, familiar to us, whom we are comfortable with, who will now have the supply directly from the government, which is exciting.
And Dr. Jane, once the supply gets to the pharmacies, how will it be rolled out from there? Will the recipients still have to follow the categories that are laid out?
Yes. So state by state, those categories are laid out. What we are hoping is as the supply increases and pharmacies feel like they've got this under their belts, like they have in the past with other vaccinations, they'll be able to supply them faster. So the states will be able to open up those categories faster. So it's not a free-for-all.
Right.
CVS, Walgreens, they still have their online signups based upon tiers. They're telling you if you are eligible now, They are telling you when you'll be eligible, but what we're hoping is by supply increasing, those tiers will move through a lot faster.
Good practical information. And doctor, before we let you go, we don't have a lot of time left, but since you're a pediatrician, I want to ask you about children. Currently, the Pfizer vaccine is approved for ages 16 and older, the Moderna vaccine for 18 and older. When might research show us that we can allow kids to begin getting vaccinated?
So, we've talked about this before, and it's very scary for pediatricians, for parents, to think that their children may not be able to get a vaccine for a while. So what we know is that Pfizer has enrolled 2,300 kids in the ages of 12 to 15, so it's already approved 16 and over, but 12 to 15, they have 2,300 kids that they are doing studies on. They're hoping to be able to release data by later this year, 6 months from now is what they're saying, early part of this year, middle part of this year. Now, Moderna is enrolling children between 12 and 17 years of age. Right now, Moderna vaccines can be given to children who are 18 and older, adults who are 18 and older, but not children or adolescents. Once they can enroll those 3,000 or 3,300 children between 12 and 17, they're hoping that they'll be able to get that data to us by the end of the year. So what we're hopeful for is adolescents will begin to hopefully get vaccines by later this year, early next year. After that, the next stage group is going to be 5 to 11 years of age. And then we may have to see decreased doses and how immunity works in adolescents before we can extrapolate that data to our younger kids.
Right. I'm looking forward to the moment adolescents can get vaccinated because they are often the weak link in a lot of families. All right, Dr. Rashmi Jain, thank you so much for joining us. We appreciate it.
Thank you so much. Always a pleasure being with you.